Well, hello and welcome to the Mindful Medics podcast, where we dive into the lives of medical professionals, exploring the triumphs and trials of their careers and uncover how they have found ways to manage stress, prevent burnout and thrive, both personally and professionally. Join us as we discover the keys to a balanced, fulfilled and healthy life in this crazy, demanding world in which we live. So today I'm delighted to introduce my guest, Dr. Darsh Shah, who is a physical medicine and rehabilitation physician in Tampa, Florida, practicing in an inpatient and subacute rehab setting. He also has a passion for lifestyle, functional and precision medicine. Aside from practicing medicine, Dr. Darsh is the co-host of the Medicine Redefined podcast, which focuses on lifestyle and health systems change. He has also presented a TEDx talk called Our Truth is Ever Evolving. Dr. Darsh is a fitness enthusiast, well-versed traveler, and avid bookworm, reading primarily nonfiction, self-help, and philosophy. So welcome to the show today, Dr. Darsh.
Thank you so much, Dr. Rhodes. It's a pleasure being here.
You are very welcome. So tell us a little bit about your early life and what inspired you to pursue a career in medicine.
Sure. Yeah, it's funny. I really don't get asked that question often. You know, a lot of people assume that a doctor is somebody who always wanted to doctor and they kind of just find their way into the path. And for me, I was always strong academically, and I always had a sense of curiosity about me. I wanted to understand more about how the world works and not just the tangible things that we see, but also more of the spiritual, you know, thinking about astronomy and the stars out there and what could be beyond. And these philosophical thoughts have always kind of meandered right in the background as I kind of went through the rigor of elementary school all the way to high school to college and then medical school. But what really kind of shifted my perspective to being a physician is how much we actually don't know about the human body, right? It's one of the fields, just like all the others out there, that it's so vital to our existence, health. But yet we probably don't even know maybe 1% of actually what happens at a cellular level upwards. And I was always an athlete. I've always learned to take care of my body. And I thought I wanted to do the same for others, which is really how I found physical medicine and rehab and, you know, more of that sports medicine angle. But truly, it was this deep curiosity within me to take a whole body approach, really learn the complexity, right? We always talk about like the Sherlock Holmes personal statement that everyone talks about, how they want to be that one person who can figure out the complex case. But more so than that, it was actually being able to talk to patients and being able to be their coach and being able to guide them. And a whole combination of all those traits really led me down the medical route.
I love that. I love that. Yeah, you often don't hear about that curiosity side of things. A lot of people, like you say, it was like, well, my family came, you know, my family was medical, or, you know, I made a decision at one time. It's funny. I'm like you. I loved medicine because it feels like you can never know it all. And I think that is a wonderful thing. There is always more to be discovered. The human body is incredibly complicated, and we're just touching the surface with our knowledge at the moment. And it's funny. I often think I probably would have been a good engineer as well, because I just loved solving problems and figuring out how things. I loved taking things apart when I was a kid, and that kind of curiosity about figuring out how things work, rather than just being somebody who is purely. Because I think medical school is very factual. It's like, here's a huge amount of information, learn it, regurgitate it. But actually, when it comes down to it in patient care, it's more than just having, an encyclopedic knowledge. It's being able to, put that into practice. And I think that curiosity that you described is extremely necessary for that.
Yeah, nailed it. Absolutely.
Yeah, wonderful. So Please share with us the timeline of your career, because I know it wasn't a straight trajectory.
Yeah, no, it absolutely wasn't. As I talk about that, I figured I wanted to be in the sciences. I was actually pre-dental before I was pre-medical.
Yeah.
And for the same reason that you kind of just talked about, my older brother was actually a dentist. And so for me, it was a very kind of easy transition. I already knew somebody who was in it, but it's not where my heart lied. It was really in
Mm.
medicine. So I went to Temple University in Philadelphia when I switched over to an accelerated undergrad track where you could do a 7-year or 8-year medical program. You get your bachelor's of science, you meet certain requirements, and you go straight into medical school. Now, unfortunately, but fortunately, I missed the GPA cutoff by 0.02. And so didn't actually even get through that program. And so it forced me to take a couple gap years. So I applied, here in the US, right, it takes a good amount of time to actually get in. Most people have to go through 2 or 3 applications. The average age of a medical student is 24. But not many of us are actually privy to that. We actually don't realize that. And so we're always looking for this instant gratification of getting in. So,
Yeah.
I didn't get in right away. So I actually had to take 2 years off as I was applying. And so within that time, I did a multitude of things. I was, drove for Lyft and had really cool conversations with people early on in the city of Philadelphia. I was a virology lab technician. And so I kind of got more of that science approach, more corporate understanding of what it means to be in a workplace. Doing some volunteering, things like that. And I was also a scribe. So I got to see the back end of what a emergency department looks like, what the doctors actually talked about, right? Because I feel like so much when we shadow is really just seeing the doctor-patient interaction, but we're not seeing doctor-to-doctor interaction and kind of the stuff that goes on in the back. And so, that was 2 years, but in those 2 years, I matured so much that it was really a blessing that I didn't go straight into medical school, because those 2 years allowed me to really focus on my identity, focus on myself, and focus on who I wanted to be when I came out of medical school, right? So I was already thinking about, okay, well, I have 4 years. Who do I want to be? Who's the person I want to be outside of after medicine? And that helped me going in, focusing on the things that mattered. So then I went to Virginia College of Osteopathic Medicine in Blacksburg, Virginia. Did 4 years there, did my internship at Penn State Hershey, also stayed at Hershey for my residency in physical medicine rehab. And now I'm here as a brand new attending in Tampa, Florida.
Exciting. And what made you go to Tampa? It's funny. My son lived in Tampa, Florida for about 18 months, and I loved it. I was really sad when he left because I think it's a great city. So what took you there? Was it just a job, or was it a more active choice than that?
It was definitely it was an active choice. I think,
Yeah.
for my wife and I, we're both very much into fitness. We wanted warmer weather. My wife's from Boston. I'm from Philadelphia. There was really nowhere in the Northeast that we could settle on, right? And kind of get this new experience. And we're very much city people. But at the same time, we didn't like the New York City or the Philadelphia where you kind of feel claustrophobic. You want to get out a little bit too. And Tampa is the perfect city to kind of have that suburban and urban feel. It's a booming city right now. We were excited to grow with the city, meet a lot of other people who also moved down here. And then for physical medicine and rehab, Florida is one of the best states to work in. I mean, there's never you'll never lose a job down here with the amount of rehab hospitals there are, and how many people are over 65, right? So
Yes.
it was a culmination of all those things that brought us down.
That's wonderful. I love that. Um, Tell me, is there a piece of advice that you wish that you'd received, like when you were early on in your career, that would have kind of changed things for you?
Mm. I would say, just like quote, take your time. I feel
Mm.
like so much of my childhood and so much, being academically oriented, you're taught to go quick. You're taught to get what you want. Even though
Mm.
delayed gratification has to be part of the process, you're taught to want it quicker. You're taught to get the research paper out. You're taught to see the patients even faster. You're taught to do more work. But when you can really take your time and go slow, you're able to process what you actually want, not what everyone else is telling you. And
Yeah.
through that, you get a better self-identity, you make better choices, and you're not afraid to say no when you need to, when you're able to take your time and you're not able to rush. Life is long, life is short, but in the end, life is your life. And that's one of the things I wish I learned earlier on that I've now begun to incorporate into my life, which has
Mm.
helped.
That is wonderful advice. Slow down a little bit
Yeah.
to
Yep.
smell the roses. I love that.
Absolutely.
Um, you had a 2 year gap year experience. I was listening to that on your TED talk and on one of
We're
your podcasts. And I think, I trained in the UK where you go to medical school at 18 years of age, which is
yeah,
like so incredibly young. I had no idea what life was about at that time. And when I meet young people today, I often encourage them to take a gap year because, that there are so many other experiences that are useful to us rather than just going straight into
for sure.
medicine. Tell us, what were the most important things that you learned from that time, from the work? And I know you also did some travel too.
Yeah, absolutely. From the work itself, I think I really just learned how to communicate, outside of medicine. So many
Yeah.
of our patients that come to see us don't know the lingo. They don't know what medicine is, right? And you spend
Mhm.
4 years surrounded by people who just know the same language you do. But once you
Yeah.
become an attending, once you actually start seeing patients, you're forced to bring the language down to English, right? Not just medicine, not Latin. And so being
Yeah.
able to communicate with body language, being able to express that you're someone that people can trust. That's what I learned by working through corporate job, by being a Lyft driver, and all those experiences. You have to build trust. You're building trust with with the passenger. You're building trust with your colleagues when it comes down to a lab project. As a scribe, you're building trust with the attending, that you can get your
Mm.
notes done. And those 2 years really taught me that I wasn't just studying for myself. I wasn't just working for myself, which is what we do as we train to get into medical school. But you're part of a bigger world. And there's going to be people who depend on you. So what type of person do you want to be? Who is that person that you want to be? What are the things that you value? And how do you incorporate those things you value through the habits that you create? So I really, really got involved into the personal development realm from those
Yes.
2 years off. And, we got to read a lot more books on them. And it really just helped secure my identity and be more confident in who I wanted to be and how I wanted to show up for the world. Which traveling, of course, did the same thing. I,
Yeah.
in medical school, went to El Salvador. San Salvador is a city to do a mission trip, right? And you get these
Wow.
experiences of culture and just seeing how the world works and how, oftentimes before social media became so big, I mean, even with social media, I feel like we're so siloed in our environments. And when you're
Mm.
able to travel, when you're able to meet people from different cultures, you start to realize that the world is a lot bigger than just the four walls that we're constantly surrounded in.
Yeah. And I'm curious. It's interesting. I worked for a period of time in rural Malaysia,
Mm.
back when I was a medical student. And gosh, this was over 30 years ago. So I'm showing my age there, but it was such an eye-opening experience. Having come from a country where we had fairly modern medicine and big hospital systems and you know simple things like cleanliness of water and access to healthcare and food and it was just one of the best experiences. I'm curious with your experience in San Salvador, what did you bring home from that you kind of incorporate into your work today?
Yeah, I think one of the things was that you're not going to be able to help anyone recover 100% all the time. You're not going to be able
Mm,
to provide all the resources that you think somebody should have, and that we live in a
yeah.
world that is unfair, that things will be cut short. But all you can do is do the best that you can for whoever's in front of you, whatever that may be, and then do the same for the next patient and the next patient. And not to kill
Yeah.
yourself over the fact that, you couldn't provide certain resources. Because everyone
Mm.
lives in a different situation. But again, our job, is to provide that the best we can. So,
Yeah, absolutely. And it struck me from what you were saying as well. I think, working somewhere where there isn't an abundance of resources also can make you more resourceful. It
that's
makes
very
you
true.
more
Yeah,
kind of creative about, how to solve problems. And it's very easy when you have access to all of the tests and all of the treatments and, to this complicated medical system. But when you find
hmm
yourself somewhere that's that has a more simple medical system, you have to think a little bit more
yeah,
deeply.
And oftentimes
Yeah.
I feel like it'll make you a better doctor because of that, because you're
Yeah.
forced to step out, become a generalist, and just think first principle thinking and just start thinking about the basics. And yeah, exactly what you said. Yeah, it makes you think a little bit more.
Yeah, indeed. So tell me, have you had any experiences in your career um, of stress and burnout? Have you been affected by those?
Absolutely. I would say residency was probably
Yeah.
the first time I've ever felt burnout, maybe depression, even if it was for
Mm.
a short time. But I've
Yeah.
always been somebody who's been energetic. I've always seen the positive, outlook on life. And there was a time in residency as an intern, January, it's cold in Hershey, Pennsylvania. Um, I wouldn't say I had the best team that I was working with.
Mm.
We always are rotating, working with different colleagues and things. But I felt a lot of burden during that time. And it was just me by myself. My wife was back up in Boston. And it was really just this regurgitation of getting up, going to work, coming back when it's dark, burning myself out at work, trying to cover for myself and whoever else may need help, and then doing it again for a month straight. And so that is just like a really difficult time where you're trying to see the end of the tunnel, but you can't because you're so focused on the present moment. But that present moment's not
Mm.
fun, right? And so I think
Yeah.
that's where some people always talk about, well, the present moment is now. But people forget often that the now for a lot of people is not the most ideal time or experience, that they need to look forward. So that was
Yeah.
definitely an interesting juxtaposition that I went through in my life, as a meditator and somebody who really preaches about being in the now and being in the present moment. It's not always the best time to be in.
No, very, very, very true. Yeah, the present can be very painful sometimes. That's for sure. So I love that you've kind of you've touched upon mindfulness practice and you have explored personal development and philosophy. So tell me, what have you discovered as kind of your personal formula for for managing stress and staying sane and preventing burnout?
Yeah. So, one of the philosophies that I subscribe to, and I mean, it's probably not even a real one because it's just, it's a combination of a lot of different things. It's more of a theme, but it's developing range. And so it's a concept by David Epstein, and probably originally by Robert Greene, who wrote the book Mastery, which was about,
Mm.
as you go through your career, do you want to become a master and become more super specialized versus being a generalist? And what, not necessarily Robert Greene, but what David Epstein would maybe argue is that being a generalist is the best way to go. And the reasons for, I believe, is that we live in a world now where there is so much interaction every day, and there is so much new development, there's so much new technology. We are almost in a constant state of FOMO and a constant state of grabbing another opportunity because there's so many different parallel universes hitting us at one moment. We can no longer
Mm.
plan anything out a month or 2 months out, because you might see an opportunity come your way next week. And if you take that, it changes the entire course of your life. And so what happens when you have range is that you are no longer just super specialized in what you do. You're no longer singular focused. You are backing away and you're trying to develop a bigger skill set. You want to learn. I would love to learn about engineering, for example. I don't think I could ever be an engineer. So I'm taking a master class right now on space exploration and just kind of learning about, oh, well,
Yeah.
how does this relate to, SpaceX and what Elon Musk is doing? And how do all of these things relate? Because the world is interconnected in the end, right? And that's one of the philosophies I believe. But when you have range, I think it makes life so much more fun. You're able to enter different conversations, really talk about anything you want. If you get bored of one thing and you feel that burnout, well, let me leave that for a second and go play tennis or develop the other passion that I had. And so I think when you're able to kind of bounce in and out, live in this gray area, this maybe nebulous, uncomfortable place for a lot of people, I think the more you stay in it, you actually gain more comfort knowing that you can go around in different places, and that life doesn't have to just be kind of one color or one road, but maybe more like a spider web.
Yeah, I love that. I think rigidity is, about the way you think or what you do in your life is often a problem. We want to be heading more towards flexibility,
Okay.
and in order to do that, you have to have that range that you're talking about. I love that. I
Yeah.
haven't thought about that concept
Yeah.
before. Thank you for sharing that.
Yeah, of course.
Um, so. I personally love being a podcast host, and I am so impressed with your podcast career. I was just listening to a couple of your episodes earlier on today, and you are like over 150 episodes. That's amazing.
Yes, thank you.
Uh, what you have a lot going on already. What made you decide to do a podcast, and tell us a little bit about what the mission is.
Yeah, so I'll first start off by how it kind of came to fruition. So I was on the interview trail, and my co-host, Dr. Altamash Raja, he was a resident at Johns Hopkins in physical medicine rehab. And so I met one of his co-residents at a conference, and I guess on the flight back, my co-host and that friend I met were talking, and the friend told him, hey, you'd be really interested in what this guy does on his Instagram and social media. So he took a look. It was like, oh, very similar interest in the lifestyle medicine, working out, personal development type of things. So when I went to go interview at Johns Hopkins, I actually met my co-host. And it was funny because we were sitting down for dinner, and near the end of it, he said, let me grab your number. I feel like our paths are going to cross in the future at some point. And lo and behold, he called me one day and said, hey, we're part of there's something called the Doctor Podcast Network, which is no longer a thing anymore, but they were basically bringing on different podcasts. And he said, would you want to do one on a mission, which is about lifestyle optimization, which is about changing the way healthcare is done. Our tagline is putting the health back in healthcare. And we truly believe that has been lost. And from an early stage in medical school, both of us had this passion for really pursuing lifestyle medicine, talking about things like exercise, nutrition, diet, stress management, sleep, and just all the different research that's out there. And how do we kind of bring this into one form and educate people? And at that time, podcasting was kind of getting hot. So we decided to do it, get in the ears of people. And we took a 4-month sabbatical, but now we're back. And it's been great. So we definitely talk a lot about system change. So we kind of zoom out, look at the hospital system. We ask our guests what they would do differently. Then we also zoom in on individual topics. And again, those can range from anything within the realm of lifestyle medicine. So,
yeah, I love it. It's very impressive, and I think it's a great way to reach people with free content and to make it very accessible to the general population. I think it's personally one of my missions. I nearly died of COVID, and I was just thinking about it today. It was 4 years ago, and I had kind of had a deathbed moment where I decided that I wanted to improve the lives of 1 million people by improving access to health and personal development information. And
yep.
you're kind of living that mission as well. I think it's a wonderful thing if we can empower people to take responsibility for their own life and not be so dependent on the healthcare system.
Absolutely right. It's about being proactive rather than the reactive model that we have. Yeah.
Yeah, and so much illness is preventable through through fairly simple lifestyle change as well.
Absolutely.
Wonderful. Tell me, I know you're very active on Instagram as well, which is how I found you. I've been following you on Instagram for about 6 months. What makes you committed to kind of doing that work as well? Like I said, you've got a lot going on. You could easily drop the podcast or drop the Instagram. Why do you put the effort into that? Why is that important to you?
Yeah, I think it comes down to the range, and it's a mission I believe in for people to try to seek out in their own lives. And I try to pride myself on being authentic and trustworthy on Instagram. So, if people who follow, they're going to see the real me, and I try not to hide that. And so a lot of people say, well, why don't you only just show medicine content if your handle's Dr.Darsh? And well, my life isn't only just medicine. And so I don't mind people seeing me, if I had to go out to a party or if I had to go out to, I want to show them the real life of what it is to be an individual in this world and someone who just is a doctor. Right. And so it's funny. I mentioned this in my TED talk, but one of my microbiology teachers, he always said a doctor is not who you are, it's what you do. And so that when I heard that, it really reframed how I should kind of present myself and the life I live, and not be so tied up in a singular identity. So that's really been the main impetus for me to kind of continue with Instagram and social media.
Yeah, I love that. And I think, it makes you more of a relatable role model when you show your whole life. You're not
Right.
just, a lot of people put doctors on a pedestal. It's
Right.
like you're
Right.
this kind of brainiac who went through medical school. And, as you and I both know, there's a lot of doctors who have a bit of a God complex,
Yes.
but we're not all like that. And I think
Absolutely.
your authenticity and your vulnerability does definitely build trust with people, and that's missing a lot in the world that we live in today. So
Right.
I really admire what you're doing, and I think it shines out that you are somebody that can be trusted, and you are living proof of what you preach.
Well, thank you. Appreciate that.
Yeah, yeah, you're very welcome. So tell me, based off your medical career and your very varied life experience, what are your three top pieces of advice that you wish people knew on how to stay healthy and live their best lives?
Ooh, on how to stay healthy and live their best lives. Okay. Number one, I would say is trust your body. What I mean by that is listen to the signals, right? Don't do recovery techniques just because somebody said so. Do it because it actually makes you feel good. Don't eat the
Mm.
things that other people are eating if they don't make you feel good, right? The body's in it. It's a unit. It's very individual. Your genetics are going to be different. Your lifestyle is different. So treat your body different. Treat it as an N of one, right? Which is where that precision medicine aspect comes from. Number two, I would say is have balance. I think right now in social media, we're seeing a lot of people maybe go a little too restrictive or show off the 6-pack abs, the 8-pack abs, and try to sell courses on that. And people need to realize that the people who have those figures and aesthetics that you're looking for, they're doing that full time. And we could all be that.
Yeah.
If our lives were like that full time, we would all be there. So remember that your life, again, is individualized and that you have your own goals to reach. Third thing I would say in regards to a healthy lifestyle is play the long game. I think it's okay to have sprints, when you're, especially let's say in the weightlifting room, you're going to do 3 months of strength training, then you're going to do 3 months of hypertrophy. But even when it comes to like our own lives, if somebody's becoming a new parent, you're maybe going to have to not go to the gym for a little bit for a 6 month to a year stretch. That doesn't mean you're not a gym goer, right? So don't identify yourself with what you are in the current moment. Identify yourself with the long-term trend, zoom out a little bit more, take it slow, smell the roses, like you said, and just realize that the pendulum swings back and forth. But play the long game, figure out who you want to be in the end, and keep those core values there.
I love that. Absolutely. And I think, people are starting to really accept, at least in the medical profession, that, chronic illness doesn't occur over like a 2-year period. It occurs over a lifespan.
Right.
It's like, and I'm particularly interested in brain health and kind of preventing, dementia and
Mm-hmm.
Alzheimer's in particular. And we now know that disease process is probably starting in people's 30s and 40s, and
Right.
and committing as early as you possibly can, and for the listeners, today is the day to start.
Yes.
Don't feel bad if you've not been doing this up until now, but the changes that you make today will make a big difference going forward, and playing that long game is really important. That's wonderful advice. Thank you so
Yeah,
much for
of
sharing
course.
that. So before we finish up, is there anything that you're working on right now that you'd like to share with our audience?
Not much besides the podcast. So we're back to putting out episodes. We're continuing to record, weekly, bi-weekly, however much it takes, and we're back to publishing episodes. So we're excited because I think in this 4-month break that we both had, we became a little wiser. We listen to other podcasts. You get to step outside of kind of what you're used to, and the questions we ask now are a little bit more involved. They're a little bit more gray. They push back a little bit. So it tends to bring out better conversation. I think it pushes the boundary, which is what we need. I think, like if you look at the political landscape that we just had, if you look at just the world itself, I think it's in need of a little bit of a push to kind of just get the truth out. And so we're excited. We're excited to kind of bring more episodes to everyone.
Wonderful. I can't wait to listen to more. You really have created a wonderful podcast, and yeah, I can't wait to hear more. So
Awesome.
thank you, Dr. Darsh Shah, for being our guest today and sharing your wisdom and life experience with us. And to the viewers and listeners, thank you so much for choosing in. Please share this podcast with any friends or colleagues who you think might benefit. And don't forget to follow the podcast so you don't miss a single episode. And finally, I wish you a healthy, happy, abundant rest of your day. Bye for now.